Evening everyone, my name is Harpreet Kaur and we are a group of three members Jasminder Bangat and Prabjit Singh. Today we are going to discuss on psychological impacts of COVID-19 on minority community. COVID-19 pandemic has exposed a suboptimal response to this threatening global disaster, including the response to the psychological impact. It emerged from China in 2020 and affected people worldwide. COVID-19 spreads from an infected person to others through respiratory droplets and aerosols that can vary in size, such as large droplets that fall to the ground rapidly near the infected person or through small droplets. These respiratory droplets and aerosols are created when an infected person breathes, talks, sings, coughs, or sneezes. It can also spread by touching your mouth, nose, or eyes with unwashed hands. Different psychological impacts of COVID-19 might have anxiety, panic attack, depression, as well as suicide. Begin with the signs of anxiety. The person who was having COVID-19 feel overwhelmed because they were not aware about the situation and they were not sure that how to deal with this situation. They also feel restlessness because of isolation for the weeks. They also feel irritability because of isolation as well as they were not having social contact with their family members as well as friends. They also feel sleeping problems as well as persistent worry. Coming to the signs of depression, the person who was feeling illness was having lack of pleasure as well as interest. They also feel guilty about that they were not unable to do their basic things and they were having negative thoughts in their mind. There was also lack of energy due to illness as well as excessive sleeping. Signs of suicide include erratic behavior. The person who was having COVID-19 was having unusual behavior and there was not a hope that they will live again or not. They also feel demotivated about the life and sadness that they lost their jobs or their family members. Signs of panic attack include rapid heart rate, sweating and trembling, shortness of breath as they were having a sickness and feeling fatigue, feeling of dreads and feeling of fear that they will not live again. The next part is the effects and that will be covered by the Prabjit Singh.
Thank you, Harpreet. So, my name is Prabjit Singh, and I will start with effects of COVID-19. To initiate with the effects of COVID-19 on the minority group in Canada, we will discuss it by categorizing into three main branches. First of is social, another is economic, and last one is healthcare. Social effects: closure of hotels, religious places, and restaurants or other entertainment places have had a huge effect on people because on a daily basis people used to go on their religious places or their favorite restaurant, but if they were not able to go there, so they were restrained to their own places so they can have social bonds with their friends and family and all. Eventually, this thing led to stress among the population and disruption of relationship with one another. Apart from this, there were another also like disruption of festival events, cultural factors, cancellation of being event like sports, poor or improper services, and disruption of traveling sector. Normally, people go to festival events or other cultural events because it gives them immense happiness and people get to know to new people. So when these things were closed, so they were having a kind of shock and they were suffering from stress and all. A lot of people were not working properly because they were having restrictions over work and as well, so people were not even getting the proper services regarding to restaurants or other other sectors such as banking and etc. So they were having a issue over that as well. Next is healthcare effects. As there were a huge number of cases and every day new patients were added, so it has a negative impact on the services regarding to healthcare sector. There were lack of doctors, medicines, vaccines, as well as number of beds in the hospital, due to which minority sector lost their lives as well. Due to overload patients in hospital, patients were not able to get basic medical care, which made their condition worse. They were not even diagnosed with diseases. On the other hand, doctors who were working overtime in the COVID, regardless of their health and self-time feeling fatigue, which affect their performance as well. They were working whole day in order to save the lives of patient, which was recommendable, and at the same time this affect their health. Also because treating COVID patients, some of the doctor were also became a victim of COVID. Another challenges was neglection of some patient during pandemic. Definitely, I believe that there was a burden on the healthcare service due to which some patient might be neglected and they didn't receive the basic health care. Due to overload of patient in the hospital, there were lack of quarantine areas where patient can be isolated. Moreover, cl- class of doctor on healthcare worker has devastating effect on the diagnostic system as well as treatment methods. Last effect are economic effect. Due to pandemic, world has suffered with huge effects on supply chain. So it slowed the manufacturing rate of goods and supplying it as well. So especially people living in minority group in remote places have suffered a lot because most of the things are supplied through roads or air, but the whole transportation system was affected, so their goods were even more expensive. Moreover, losses of national and international business affected people doing jobs. So basically, poor market cash flow affected each and every people, especially people living in small and remote area has suffered a lot.
Thank you, Prabjit. Now I will continue with the impacts of COVID on indigenous community in Canada. COVID-19 in indigenous communities elevated psychosocial stressor and exacerbate health inequities. Psychosocial stress is an etiological contributor to behavioral, mental, and physical health problems, according to recent survey in Canada of Indigenous people, in which reveals that 6 out of 10 participants reported worse mental health due to COVID-19. Nextly, method of strengthen the community. Specialized mental health services that are accessible and have equipped teams. Frontline services including psychological first aid training as well as a social prescription. Fostering community resilience. Respond to the social needs of the individuals or communities. Volunteer teams who aim to support individuals to take greater control of their health. Nextly, psychological first aid, and there are 4 L's: look, listen, link, live. So, in the look, an awareness that there is a problem with what stress look like in ourselves or others. In a listen, listening to the warning signs in yourself or others, and in a link to self-care plan or resource in your community, and in a live to the fullest bouncing forward. In the end, we concluded that there should be pre-assessment of the teams regarding the emergency conditions, such as healthcare teams. They should be aware if the emergency condition will occur. They have a stock of medicines and the other equipments that are essential for the treatment of a patient. Moreover, these teams should be work in a collaboration so that effective solution should be taken. Lastly, the psychological effect will not go away along with the pandemic. They are going to last longer. Thank you. So, so in the end, I would like to say these disaster has a long lasting impact on a people that will heal with the time. So these are references and thank you from my team.